This is our second State of Affairs, and we're at the point in the project where we're giving some feedback on some of the high-level findings from the data that we've collected from our 5 participating organisations. And we've also had the opportunity, and I think privilege, to hear from some of those organisations, the leaders in them, about how the project is going from their perspective and the sorts of things that they're doing.
This study and research is actually very important for the whole industry, because staff shortages is unfortunately a reality in the industry, and staff burnout is very much one of the consequences of that. It's also intensively emotional work and sometimes very physical work.
I guess we started with the recognition that mental health and wellbeing is a challenge in this sector, and sort of reminded people of some of the findings that came out from the previous State of Affairs around the growing number of psychological injury workers' compensation claims. But then really what we were focusing on today is saying, okay, we know there is a mental health and wellbeing challenge for many people. Why? And in particular, what is the role of work design in explaining some of those issues? And so what we were able to unpack are some of the particular work design pressures that people are facing in this sector. And the importance of that, I guess, is to really provide some guidance about what are some of the next steps that organisations need to take to create better work design, which enables that better mental health, which hopefully then reduces those psychological injury claims into the future.
The time demands and emotional demands, which are part of our sector's work and which have only gotten worse through COVID, are, even if we can't necessarily reduce those in a big way, or they're not within our control to reduce that, working on other things like agency and connectedness within the workplace can actually reduce the negative impacts of those things. So I think that's a really important message, because what we do as managers, what we do in teams can just help us manage those time and emotional demands.
The well-being of the workforce in disability, aged care or any community program is essential to provide safe and quality supports to the people who we do support, and that is the importance of participating in this project.
As a partner of the Design for Care project, I would definitely recommend agencies supporting this process or participating. I think that we've learned a lot in the last year around what Design for Care is and how it impacts our staff's retention and engagement. I think this is now business as usual, and I think we have, as leaders, we ought to be doing more of this to ensure that our staff are supported, they're looked after, they're getting the learning and development needs met, and they're supporting our clients as well.